Hello, everyone. So today we have Dr. Sonali Badve with us, and she is an international dentist. Dr. Badve, would you tell us something about you first?
Yeah. Thank you for having me, first of all. My name is Sonali, and I did my BDS from Bharati Vidyapeeth in Pune, Maharashtra in 2010. I moved to the States in 2012, and I was here on H1 dependent visa, H4 dependent visa, and ever since then, my journey has been of a dental assistant, then dental hygiene, and now I'm applying for my first capit cycle. So yeah, that's me in a gist.
So you said that you're working as a hygienist, and I believe you've done the 2-year hygiene course. So my first question to you would be that why did you choose hygiene over applying for DDS directly?
Right. So when I came, like as I mentioned before, I came here on an H4 visa. Now, when I got my work authorization, dental hygiene actually helped me get a job instantly. I didn't have to ask for an H1 visa. So there were like visa issues. So this hygiene helped me with that. With the dental route, it was at that point, it was too expensive. There were financial barriers, and plus motherhood took over. So I thought dental hygiene would give me the right balance, the work-life balance, and it proved to do that. Yeah.
You did the hygiene school, which I believe is a 2-year course. Uh, so, can you tell us a little bit about the application process and any prerequisite courses which were required for your application?
Absolutely. If you plan to take the hygiene route, the school route, there are many options. So you can either go to a community college or you can go to the like a private school as well. Now, depending upon which school you choose, you can do and this hygiene program requires prerequisite courses. Some of these schools have the prerequisites as part of the hygiene program. Some, like some colleges, they don't have that. You can do them separately. You can do them at your own pace. In my case, I did them separately and I did it at a community college. One reason being it was way cheaper and I could do 3, 4 courses at the same time and work at the same time. So I didn't want a loan, for dental hygiene program, and that helped me with it. Now the prerequisites are, I think there are 9 subjects in total, and I actually made a list of it. Sorry. It includes sociology, English communication, psychology, organic and biochemistry, anatomy and physiology, microbiology, fine arts and humanities, and nutrition. So these are mandatory. They don't waive them even if you are an international dentist. And then the hygiene courses together, so the prereqs and the hygiene courses together, they're somewhat like 85 credit hours, so that is how long the program is for.
Okay. Like you mentioned that some hygiene courses had the prerequisites integrated into their course.
Yeah.
So for those applications, you did not need to finish those prerequisites earlier with the application process, and you could do it with the school. Are you saying that?
Yes. Yes. So all you had to do was apply to the school, and then they would teach you everything from the basics.
Okay.
So then it wouldn't be a 2-year program. It would be, I don't know, 3, 4 years programs. And then another thing I wanted to add over here is that so some colleges, like I'm from Michigan, so like University of Michigan, for instance, they offer a bachelor's program. So, but community colleges only offer associate level associate degrees. So after I believe the 3rd year, you get an associate degree, and if you want to do the extra year, then you get a bachelor's in dental hygiene. But you are eligible to work on an associate degree, and the pay is the same. Now, the only advantage with a bachelor's degree is that if you choose to teach at a school, then that bachelor's degree can help you.
Is it easy to get in the hygiene schools?
As international dentists, I would definitely say it is much, much easier for us as compared to another student. Like I said, the prerequisites, if you are done with them earlier, they'd include like anatomy, physiology, biochemistry. This is something that we are used to. So getting a higher GPA in these prerequisites is very easy. The program that I went to at the community college in Michigan, it's a very competitive course. Many people apply over here because it is only a 5 semester course. So it's a very fast paced course and they only see your GPA. So if you have a high GPA in the prerequisites, then your chances of getting into the program are very, very high. So to answer your question, is it easy for us? I think it is definitely easy.
Another important question: what kind of investment do we need for studying hygiene?
So for studying hygiene, I would say the see, that's the thing. So if you do it at a private college, it's going to be more expensive. At a community college, it's going to be cheaper. I believe at University of Michigan, it was for the entire program, it was about $60,000, whereas at the community college I attended, it was about 15 to 20 grand. And this is including the prerequisites. In addition to this, there are many scholarships that you can apply to. Now, if you are permanent resident or if you are a citizen, then the amount of scholarships that you can apply to are even more. But at the time when I did it, there weren't so many, but there were, there were scholarships that I could apply to. And, they also help you with the finances.
That's very good information. So, and what kind of return of investment are we looking at once we start working as a hygienist?
So the return of investment is pretty good. They earn about, so depending upon which state you're from, um, I believe in California or even in New York, it's about $80 an hour. In some states, it is about 45 to $60. You know, so yeah, on a yearly basis, it comes to about like 80 to 100K.
You have a local anesthesia and nitrous oxide licensing. Can you tell us little about that?
So the local anesthesia and the nitrous licenses, this was taught as part of our curriculum, and it was highly encouraged to us as students to go and give those exams and get licensed for it. It has definitely helped me in my day-to-day practice, especially like dealing with dental anxiety, patients, or even doing like SRPs. So yeah, I would definitely recommend, if anyone takes this route, definitely get your licenses for local anesthesia and nitrous.
And any other licensing you would recommend for any of the people who decide to get into hygiene?
So one thing that I strived was to learn the digital side of dentistry, mainly because with the background of being an international dentist, I wanted to learn more. But as a dental hygienist, my scope was very limited. So what can I do, as a dental hygienist? So I learned lasers and application of lasers in the dental hygiene, arena. What else? Even digital impressions. We have the iTero machine, but there's so many others. Learning the CBCT. Then there was another office that I worked at where we used the Diagnodent. So all these, like how to incorporate dental technology in a day-to-day practice, is something that I would highly encourage everyone.
Everyone knows about Florida hygiene exam,
Yeah.
and that's the preferred route for most international dentists. Would you recommend your route over the Florida hygiene route?
So when I went to school for dental hygiene, the Florida licensing was not there. So if it was, I would have definitely opted for that. But having said that, going to dental hygiene school has taught me a skill, that I don't think I would have learned in a private practice if I would have cleared the licensing exams for Florida. It definitely taught me how to deal with patients on a day-to-day basis. It taught me the the aspect and the communication, how to convince people, and all these things are actually taught in school in addition to the science aspect.
And I'm quite sure that these skills will help you in the dental school as well as in your private practice after
Yes,
you get your dentist license.
absolutely.
So yeah, so I mean, it was a smart way of getting into dentistry and stay connected to dentistry while being in the United States. Also, I believe that this is your first capit cycle. So how are you planning to leverage over your hygiene license in this application?
I'm just honestly just going with the flow. I've added all my experiences, and to actually, because it's been almost 15 years of experience here in the United States. So remembering each and every single thing has been the biggest challenge for me. But I think being up to date, with the latest technology, that has really helped me. And that's what I've entered in my application.
I really hope that you are able to gain that leverage in your application with
Thank you
your
so much.
hygiene license. We often see people who have hygiene license get selected. Some schools really prefer hygienist because of their dental experience.
Thank you
Good
so
luck
much.
with your applications.